What are the adverse effects? A general increased risk of dying, a specifically increased risk of dying of heart disease, lung cancer and suicide. Now that's been controlled for smoking, by the way. General poor physical health, including heart disease, high blood pressure, chest, whatever, read them. Poor general affection and self-reports on the health, an increase in long-term illnesses. Just to continue, by the way, poorer mental health, the depression we just talked earlier, increased likelihood of suicide attempts, and just increase in actually attending the doctor and to go to hospital.
So that's also from people who are not able to go back to work because they are ill?
It includes those people, although...
So people who can't go to work because they're sick go to the doctor more often?
Some of them do, that's true.
Yeah.
Yeah, so it includes those.
Yeah.
However, just to touch on that, there's little evidence, if you look at either injury statistics or work statistics, there's a very poor correlation between the severity of the condition, the diagnosis, and worklessness. Most people with most conditions actually work. So the issues around why people don't work is much more complex than the diagnosis.
That's the reason that the WHO gives us not only diagnosis, but impairment and disability.
You're leading into just where I'm going. Thank you.
Does the longer people are off work increase the risk of all of those things, or is there a...
No, that's definitely... The timing factor is quite critical, and most of these are... If you had to have a time, like a cut-off point, though obviously that would be completely artificial, it would be about 12 months. So a shorter time period, some of these impacts can occur, but they're less pronounced. And, but certainly, again, the psychosocial impacts, and that was taken from a journal, admittedly it's quite an old paper, but it is nonetheless recent research would tend to consistent with that. That just happened to be the reference that I came across. Lots of the things that we touch on may seem logical, but they haven't necessarily been shown by studies, and I guess that's what we're trying to suggest here, or not suggest. The presentation here really is around the fact that there is actually good evidence to support these. This is not supposition or a value-based, judgment, I suppose. I guess this was the one that bothered me the most, actually, which is the impact on, really on the families, and that is the fact that children from families with unemployment, although you'll note this morning there was a useful comment made about the fact that you may well be looking at some other compounding factors such as levels of parental education, etc. But my understanding is these incidents arise despite that being controlled for. So more chronic illness, more likely to be out of work themselves, and also the other impacts of what we'll call psychological distress in children, it's shown up by anxiety, depression, delinquent behaviour, and certainly substance abuse, and that certainly can be an issue. But obviously, there are some people where a benefit is essential, and sometimes in the short term, and sometimes over an extended or possibly lifetime situation. So to some extent, there are times of benefits absolutely essential. There are components at which there is a grey area. What we're suggesting is that treatment and a return to work could be happening at the same time. You needn't wait until full recovery. And certainly there's good evidence that show that people recover quicker and in a more timely manner and feel better about it if those things happen simultaneously. But the bottom one is terribly important, and this is where employers need to be engaged in the process. It is around the right accommodations, and of course I don't mean where you live in this situation. It is enabling people to go to work. Do they need altered work situations? Do they need lighter work? Do they need some other facility that might enable work to occur? Now this was kindly introduced earlier, which was the International classification of function, disability and health. This has come from the World Health Organization, from their paper Towards a Common Language for Functioning, Disability and Health, which really tried to move the discussion away from a focus on disability more to a focus on ability. And I noticed there's some good sessions already lined up for that tomorrow, both morning and afternoon. I just briefly wanted to say, I mean, basically it's saying, as we alluded to earlier, that it isn't the diagnosis per se, it's a number of factors, the personal factors, the environmental factors, how it impacts on your body function, what activity you do, whether you're able to participate. And those are a collective number of things. And at an individual level, it's about what is their level of functioning. How do they rate themselves? What interventions might maximise their functioning and how useful and what are the outcomes of those interventions? At an institutional level, this means what services will be needed. How well do we serve our clients and how cost effective are the services? As indicated earlier, just throwing money at it wouldn't necessarily be helpful. But at a social level, what are the criteria for the eligibility for disability benefits actually evidence-based? Are they appropriate to our social goals? And are they actually justifiable? Which I think, all of which are different questions. What are the needs of a person with a certain level of disability? And how do we incorporate what I've called reasonable accommodation to make our environments more accessible for all persons? And can we assess and measure whether that makes a difference? The determinants of health. This is my favourite slide I like to show to my medical colleagues and remind them that they're only one little part of what makes people healthy. I actually would like to say health and well-being, I must admit. The others are terribly important, and you know, whether you get to see the doc or not might be useful, but it needs all the other factors as well. The non-medical factors, clearly there are other factors involved. Other facility that might enable work to occur.